Yo, what up? It's a tip of the week, and today we're going to discuss the basic drugs you need for your drug kit. This is going to be part 2, so buckle up and let's roll. So once again, make sure you know where your drugs are. Make sure they're not expired, and make sure you know how to use them. So when an emergency happens, you'll be ready to rock and roll. All right, the first drug we're going to talk about today is albuterol. This is a drug that allows a patient to recover from any type of asthmatic type of challenges. The route that you want to use it is going to be oral. Have the patient shake it, 2 puffs, 3 puffs, depending on the situation, and you're ready to rock and roll. I generally use that for patients if I'm going to be doing a procedure and if they have a history of any type of asthmatic challenges, or anything any type of respiratory challenges that they use this medication. I'll go ahead and either have them take it themselves, or I'll administer it myself from my drug kit. Number 2, epinephrine. Now, this has been a drug that has eluded me for many years. Oh my goodness, this thing has eluded me. And I wanted to go ahead and make this video specifically for you so that it will never elude you a day in your life again. All right, so you ready? All right, so this is epinephrine right here. This is an ampule. This ampule, and I'll take a picture of it so you can see. This ampule is 1 in 1,000. All right, that's a concentration, 1 in 1,000. There's different ways in which you use epinephrine. Epinephrine is generally going to be used in an emergency situation for anaphylaxis or cardiac arrest. All right, and you don't want to use the same amount of medication in the same route for either or, because you could either kill somebody or it will have very little effect on them. So just want to make sure that's clear. So number 1, this 1 in 1,000 is good as if you take out, this is a 3 ml syringe, 0.3 for an adult for an anaphylactic reaction. All right, so what I would do is this, I would get this ampule, I'd pop it off. I would say preferably using a cotton roll so you don't cut yourself with the glass. Stick the needle in, 1 milligram per ml. This is 1 in 1,000, and you'll draw out 0.3. So 1 ml, so it's going to be 3 lines, 0.3 for an adult. If it's a child, it's going to be half of that, 0.15, and you're good to go. You'll take it, call 911 or your emergency team immediately, because this is going to be the strongest drug that you have in your toolbox, in your drug kit, so make sure you do that. And place it in the vastus lateralis, basically the thigh. Grab it, make sure you get a good amount of meat, aspirate and inject, and watch how that medication goes to work. So that's anaphylaxis. Now, let's just say you have the same ampule and your patient is having a cardiac arrest event. What you want to do is get the full ampule, draw it up. But you want to get a 10 cc syringe. What you'll then do is get your water. It's a joke. It's a joke. It's a joke. Pull 9 cc's of saline in a syringe. Get the 1 cc of the 1 in 1,000. Shake it and place it in a peripheral vein, generally your antecubital fossa, and have the patient hold their arm up and push it as a bolus, and it gets to their system rather quickly. That's what you want to do. Now, I can't tell you how many years it's been at least 8 years. I've been practicing for 8 years now. I can't tell you how many years I've been struggling with this concentration business, but there you have it. For anaphylaxis, take 0.3 from this vial. So 3 lines on a 3 ml syringe. So there's 1, take 3 lines of it. If it's going to be cardiac arrest, take the full vial with 9 cc's of normal saline, Combine them together, shake it up, and there's your 1 in 10,000. So the 1 in 10,000, this is another thing that used to mess with me. The 1 in 10,000 is a weaker concentration than the 1 in 1,000. All right, so just keep that in mind. That used to really mess with me. Once, I'll say it again. The 1 in 10,000 is going to be weaker than the 1 in 1,000 because the way in which I got the 1 in 10,000 is that I got 9 cc's of normal saline and I combined the 1 cc with the 9 cc's, making the concentration now 1 in 10,000. Once again, I'm Dr. Jared Williams, and my focus is for you to smile after surgery. Make it a great one.